Hello, my name is Dr. George Rogu, and today I'm going to speak to you about flat heads in the adopted child. Many children from orphanage come home with a misshapen head and they have to go through helmet therapy. Can you explain why this occurs? When the American Academy of Pediatrics recommended that all children sleep on their back, a lot of children spend most of their time of the day on their back, and the gravitational forces of the skull force their heads to flatten on their back. This does not happen in all children, but of course in children who are internationally adopted, they are at greater risk for just being left on their backs all day. Many times flattening of the head can be due to a neck problem, and if it is taken care of with physical therapy early, the problem generally resolves. Also, this can be caused by birth trauma during the delivery. This usually should be easily diagnosed by the pediatrician. Almost all international adoptees benefit from early referral to physical therapy, so that there is usually not a problem. Patients who do not respond to a change in the position or are too old to be effectively treated by positioning and have significant asymmetric skulls may benefit from a referral to a specialist in the area which deals with craniofacial surgery or neurosurgeons. The use of helmet therapy for this problem is still controversial. Whether it is helpful or not, the majority of children seem to get better even if the conservative therapies are done and they start to move around and the pressure is removed from the skull. All of these therapies depend on having a compliant parent and depend on the age of the child. The use of helmets is an interesting question in the studies because it seems that the cosmetic result is at least as good as in patients who are managed by positioning, if the child is young enough and the deformity is mild to moderate. If the deformity is severe, the child has failed conservative therapy, or the patient is older, then the helmets have their place. Children may also be referred to surgery if the deformity is recalcitrant to treatment or is due to the abnormality of the growth of the bones. This usually is detected by a pediatrician. Hopefully, this has been helpful, and there are many references available online at the American Academy of Pediatrics.